Hello everyone. Good afternoon, everybody. I'm Priyanjali from Radiance with You YouTube channel. I hope all of you are keeping safe and in good health. Today we are going to talk about a very important topic, yet often misunderstood topic, which is atopic conditions in children. Whether we hear the word rash, we usually think it's just a skin issue, but in reality, for many children, it's much more than that. Atopic dermatitis, commonly known as eczema, is not just about dry, itchy skin. It is a part of a broader condition called atopic march, which may include allergies, asthma, and allergic rhinitis. This means children with symptoms today may develop other allergy condition later if not managed properly. Children suffering from atopic conditions often face constant itching, disturbed sleep, skin infection, and even emotional distress. And for parents, it can be equally challenging to understand triggers, manage flare up, and ensure proper care. But here's the good news: with the right awareness, early diagnosis, and proper management, we can significantly improve the quality of life for these children. Understanding triggers, maintaining skincare routine, and timely medical intervention can make a huge difference. Now, let's connect with our expert today. Dr. Bharti Aggarwal is an MD and experienced dermatologist, director, Skin Tressa Clinic, Shalimar Bagh, Delhi. She is widely known for her expertise in dermatology, allergy-related skin condition, and advanced skin treatments. Her clinical experience and patient-centric approach have helped many children lead healthier and more comfortable lives. It is truly our pleasure to have you today with us, Doctor. Over to you with
Thank
the
you,
first question,
and
which is what exactly is atopic child?
thank you for a wonderful introduction. And I think you have very beautifully summarized atopic dermatitis, covering most of its aspect. So, the first question is, what is an atopic child? So, atopic child, these are the children who are predisposed due to their skin barrier defects to multiple allergies, skin rashes, and symptoms like pruritus and inflammation in their skin. So here, a child may have multiple symptoms, as you said, that there could be itching, there could be rash, there could be other stresses. Also, mental disturbances in such children are very, very common and are nowadays one of the most highlighted disease because of the high prevalence globally as well as in India.
Right. Moving ahead, Doctor, uh, let's dive into the next question, which is how is atopic dermatitis different from a regular skin rash?
So definitely, there are multiple reasons for rash in a pediatric age group, which includes infections, which includes a common contact allergies or seborrheic dermatitis. However, an atopic rash might look similar to it, but definitely has multiple differences in the form of the rash is majorly when occurring in an infant or child who is less than 1 year of age. We see that it is majorly on its cheek or the extensor areas of the body. However, as a child grows, we see that the rash spreads more to the flexure areas, your these under the elbows or under your knees, like that. And then in these rash, we see that patients have constant itching. There could be oozing. Patient may develop fissuring. Sometimes they can also get secondarily infected with some bacterial infection, and hence, patient generally have a very chronic course. The patient might take some medication and it might resolve. However, with some triggers, it can reappear.
Right. Well, moving ahead, Doctor, uh, tell us the common symptoms parents should watch for when it comes to this condition.
So, generally, an atopic child, generally the patient is brought to us by their parents, and the parents generally complain that the child is always scratching and itching or rubbing his skin. Patient is having red rashes over the body. His excoriation marks are there, scratch marks are there on the body, right? These are the few one of the few commonest symptoms that we see that the child have if he is suffering from atopic dermatitis. Then other than these, the child can also have certain conditions like constant dryness of the body. The child is always having xerosis, there is constant dryness, or patient is having white patches over the face, or some itchy nodules, itchy raised lesions which are there on the legs or the body, like prurigo simplex we say. Then the the texture becomes very dry, very cobblestoning is there, it is very rough texture of the skin. These are the few things that a parent might notice in their child. Then the atopic child can also have concomitant allergies, that like patient is always sneezing or having running nose, red eyes whenever the
Mhm.
season is changing. They are suffering from either constant common cold or red eyes, having frequent allergies, frequent food allergies. These are few
Mhm.
concomitant conditions that can also happen with atopic dermatitis.
Right. Now, doctor, when it comes to any sort of skin condition, especially that we are talking about children today, um, a major concern lies in the skin condition being contagious. So, tell us, doctor, is it possible that this sort of skin condition can spread through contact?
So I think it is very unfortunate that we are unable to spread a word that condition like atopic dermatitis do not spread by touching. It is non-infectious. It is generally because of the internal predisposition, आपके कुछ genetic predisposition की वजह से, family history की वजह से. There are multiple other factors which are leading to
Mhm.
atopic dermatitis and do not spread by touching. And this myth need to be clarified in a child mind, and also to the teachers in the school, uh, all the people who are working in the school, because I see so many kids, they are so worried and so much stressed because they always feel that their rash might spread to their friends or their parents. So I think this is a very right time that it is not infectious, so do not worry.
Right. Well, that brings a sign of relief for all the viewers who are watching us currently. Now, doctor, tell us the early condition. Now, identifying any sort of condition and any sort of disease becomes one of the major tasks for all of us. So, we know that cure in the early stage is much more easier when the condition is being prolonged. So, tell us, how do we understand the condition in the initial stage? What are the early symptoms like?
So, as I said, the earliest symptom is that patient is having a rash and it is not going away with your normal moisturizer. Your the child is constantly having dryness of the body and it is not going with your moisturizer, or the rash is now started to ooze. There is oozing, there is watering from the rash, or the child is complaining of multiple such rashes and like frequently he is having that, right? These are the few things when you should just, in the very initial stage of it, if we start some topical medications and start with certain precautions and guide the parents, we can definitely save the child from any severity or secondary infections which can worsen the rash.
Right. And which age do we need to focus on majorly? In which age group do we normally see such sort of a condition occurring?
So definitely, atopic dermatitis is a condition which is seen majorly in a pediatric population. We see that बच्चों में ही सबसे ज़्यादा होता है, specifically some children who are below 5 years of age. Post that the prevalence has decreased markedly, and in adolescents we see there is a resolution of major part of the disease. Only 20% of the patients do carry atopic dermatitis beyond adolescence. Then
Right.
in adults also we can see it, especially the children who have a very severe disease or early onset of a disease, but it is comparatively very less.
Right. Doctor, earlier you said that the condition can be genetically gained by the children. So, any prevention one should take in that case if they have seen the parents or anyone from the family suffering from the same?
So I would say we are not advanced yet to deal with that. It is a genetic condition. It has just predisposed you to atopic dermatitis, but definitely precautions like frequent moisturization of the skin. And if you see early symptoms of rash, as we discussed, then do see your dermatologist so that we can help the child as much as possible and as early as possible. I think these are the few things. If you feel their parents are having atopic dermatitis, just tell you that you might have a tendency to develop it. Doesn't mean that you might have it. So few may
Right.
and few may not. So it is just like a risk factor to for you to develop atopic
Right.
dermatitis. So there's nothing
Right.
much we can do about it. Just that if you feel any symptoms are there, or you feel that you are developing atopic dermatitis or similar condition as your parents, then you must visit your dermatologist early as possible so that they can guide you through your disease.
Right. Now, any triggers for the same, doctor, which one should take care of?
Definitely. See, as I said, atopic dermatitis is a condition we see that it is a chronic, लंबे समय तक रहने वाला disease है. So patient might have certain flares and there will be period of remission. जब बिल्कुल ही disease stable है, बच्चे को बिल्कुल भी rash नहीं हो रहा है and is happy and fine. So what are the conditions in which we see that the rash is developing or the rash is oozing? So first of all, the changing weathers. When there is changing weathers, we see that the child is having or developing a rash, or in winter season where we see that there's a lot of dryness. Then also there could be exacerbation of the rash, and then certain triggers like patient see in the dust, the pollution. All these are subtle triggers to the atopic rash. You have to make precaution that you are not going into the dust, or especially for the children who are playing outside or in the playgrounds, then they have to make sure that they are not going in a very dusty or very dirty environment for themselves, because they can easily develop a rash or worsen the rash. So excessive
Mhm.
sweating can also sometimes lead to rash because of the irritation and the constant rubbing of the skin which is happening. And then certain perfumes, the fragrances which are there in different agents that we use, either in the form of a deodorant or a scent, or sometimes in our fabric also. So many detergents are having a lot of fragrances, and we see that the child is having allergies from those fragrances. So
Right.
using a detergent which is fragrance free, using even the softeners that we use, we generally guide our parents that do not use a softener which is having any additives which can easily irritate the skin of the child, or using any moisturizers which are full of fragrance and additives can definitely irritate the child. Now
Right.
parents have habit of rubbing their child with good oil. These oil definitely have multiple additives, preservatives, which are
Mm-hmm.
irritating to the child and lead to the condition worsening of the rash. And these are few. And I also see many parents not letting the child not take a bath while they're having a rash, saying
Right.
that it might
Right.
worsen. But definitely it is a wrong habit. I see so many patients who are having infection over the rashes, and that further complicates or prolong the remission. Matlab, it becomes very difficult for us to treat such patients because then it is a longer course.
Right. Right now, we were talking about the moisturizers. We know there are a lot of products which are available in the market currently. For us, also for the child, there are many, many companies bringing out all those products which they claim that are safe for the child. And as you said, it has artificial fragrances added to it. So, doctor, how can we ensure that we are using the right product? What are the things we should look for in any sort of products that we are getting for our child?
So, majorly in moisturizers, we see that we need to have a hypoallergic moisturizer, fragrance free, non scented. It should be rich in ceramides, which really helps in the penetration. Should not have any irritating agents in it, or any active agents which can exfoliate the skin, like salicylic acid. Some of the moisturizers which are meant for the acne are being taken up for the atopic dermatitis, where we see there is a lot of
Mhm.
urea, lactic acid, which can further irritate the skin sometimes. So try
Right.
to avoid those. Now, your moisturizer, the use of a moisturizer should vary according to the season. In winters, we see that the skin becomes extensively dry, so there you can use something like an ointment based or a balm based moisturizer. However, in summers, use something like a lotion, which is not very greasy and very comfortable to the child, right? And sometimes in combination, you can go with some things like cream. So
Hmm.
try to use a moisturizer which is moisturizing your skin well and not irritating. It might have certain natural moisturizing factors, certain ceramides. We also have like uh, multiple derivatives of palmitamide. These are all moisturizing agents, added moisturizing agents which can be given. And sometimes some soothing agents are also added to the moisturizer. It really varies on the type of skin you have, how you were taking previous treatments and previous moisturizers that you have used, how they have worked for you. On those bases, we generally cater to our patients. So for patients to take something, they have to just see that it is hypoallergic, it is non-scented, it is not having any high scented or high perfume or any additives and those preservatives, the minimum.
Right. Right. Now, speaking of that, doctor, we see a lot of people who somehow prepare such moisturizers and creams at home. Basically, home remedies that we are talking about. I'll give you a quick example. There is this thing which people nowadays, there is a craze in the market. They say that washing the ghee 100 times can somehow make a moisturizer safe for everyone. They claim it to be safe for everyone. So, is it true? Does such sort of moisturizer somehow work for the children also, or is it a hoax?
So I would say that actually these are not very scientifically proven things. So
Mm-hmm.
it's difficult for me to comment on that. However, I say that these children are a little more sensitive to something like these, right? We need to give them something which is scientifically proven and it has shown good results. Now, atopic dermatitis is such a well-read disease and a well research disease that we have now came up with very good moisturizers, and patients should really realize that moisturizers are just not cream, they are actual medications for them. So it is like a topical medication that we are giving to them, especially for atopic dermatitis, because it is helping them for repairing their barrier, repairing their skin, which is broken. As I said, that atopic dermatitis is a skin barrier disease. The skin barrier जो नॉर्मल स्किन का फंक्शन होता है बैरियर बनने का, इन्वायरमेंट से हमारे को प्रोटेक्ट करने का, वो ब्रोकन है.
Mm-hmm.
आप जब तक उसे रिपेयर नहीं करोगे, चीज़ें बहुत मुश्किल होंगी. Home remedies sometimes can be irritating to the skin because we do not know how are they made, or especially also when you do not know how the hygiene has been kept. So these are the
Right,
few things that I feel that we should not experiment with, especially in a
right,
child who is already suffering, where we need to give him a better care and better guidance on that.
right, right. Now, moving ahead, doctor, towards the next question, which is atopic dermatitis linked to asthma or allergies?
So, definitely, it is a well recognized fact that atopic dermatitis can be associated with certain allergic disorders. As you very well said in the beginning, atopic march. We see that
Hmm.
child in early age has a skin rash. Post that, he starts to have these asthma and then food allergies, then allergic rhinitis, some sort of an atopic march. We see that the allergic levels are increasing day by day because we see there is a lot of role of our immunity. Generally, our immunity is in a subtle balance between different cytokines and different agents are keeping it in a balance. However, in atopic dermatitis, this balance is somehow broken. It is not
Hmm.
maintained. So, so, so because of this imbalance, the child is having all these sensitivities for themselves in terms of skin, in terms of all the mucosal surfaces, like your nose, you're having rhinitis. In the gut, you're having food allergies, right? From where the
Mm-hmm.
sensitization is occurring, and child may have different allergies other than that.
Right. Moving ahead, doctor, the next question is how can parents manage itching and flare up at home?
So, for parents to manage itching and rash at home, first and foremost, use only very mild soaps. I see parents using very harsh alkaline soaps. These are a complete no in an atopic child. First of all, use only synthetic bars, synthetic detergent bars. So, these are the bars which do not strip off all the oil from the skin and keep the skin clean also. So, use no soap cleansers and
Mm-hmm.
synthetic bars for cleaning, or liquid bars or liquid washes which are very gentle, which are pH balanced, hypoallergic for the child. Then after the your child has taken a bath and the skin is slightly damp or wet, apply good amount of moisturizer over the entire body. It is soaked
Right.
well and locks the moisturization in the
Mm-hmm.
skin. Then even moisturizer is something that can be applied 2 to 3 times a day. It is not a problem. You can frequently apply moisturizer over the rash or the irritated part of the skin. And even if it does not subside with it, then see your dermatologist, because then we have certain topical medications that we can add on to help relieve that rash for you. If the rash is mild, it will be dealt with this simple technique itself.
Right. Right. Well, the next question, doctor, is what does diet play? What kind of role does diet play in atopic conditions?
So earlier it was not identified that much, but now we know that diet have a major role also in atopic dermatitis, because we have realized that there is a lot of inflammation in the body, there is a lot of toxins which are being released, and the diet does play a role. Having an antioxidant rich diet really help calm down that inflammation in you. Then patients who are having food allergies, if you are constantly taking those food, it is increasing the allergic levels in your body. So somehow the
Right.
allergy is still at a peak, and that will be
Mm.
not shown up just in your body but also on your skin, right? So
Right.
sometimes despite of taking medication, if somebody is allergic to something and they're constantly taking it, then they will have a constant rash. And also sometimes atopic dermatitis in itself predisposes you to certain gut problems and gut issues. So if you are constantly having a rash and also certain gut issues, then you must visit your dermatologist, because then we can put you up on certain tests and see if there's something wrong or not.
Right. But
And
moving
also to
ahead,
mention,
the next. Yes. Yes, doctor.
nowadays the gut microbiome, the healthy bacteria which are there in your gut, they are also playing a very important role in your skin condition. So the probiotics are also have shown that they are really helping atopic child. So something
Mm-hmm.
that you're taking orally is does having effect on your skin. So proper intake of water and definitely a better diet and all this are playing a role in atopic dermatitis.
Right, right. Moving ahead, doctor. Uh, what about the long-term complications if we leave it untreated? I mean, we have this tendency of, prolonging any sort of condition कि देखते हैं कुछ दिन और ठीक हो जाएगा. अच्छा ये दवाई लगा लगा लेते हैं 2 दिन देखते हैं and then maybe we'll go to the doctor. So what are the chances of worsening of the condition if we leave it untreated for a long time?
So I know that we have a tendency, but I think patients should realize that atopic dermatitis, when dealt the earliest, is the best, because when your barrier is weak, you are exposing your body to different environmental infections also. So we see that if
Mhm.
the child is not being treated properly, most important or the most common thing that we see is skin infections. Child develop multiple skin infections. There is pus discharge, having fever, and these infections may not just limit to your skin but also spread to your body, leading to fever and septicemia and everything if left long. Or a skin will try to protect itself on its own by thickening of the skin. You see pigmentation, black thickening of the skin, मोटे हो जाते हैं वो निशान, जिसको हम
Mhm.
लाइकेनिफिकेशन भी कहते हैं. And now we, as I've said, and realize that there is systemic progression also happening, like atopic march is also there. So if you're treating your
Right.
child early, you're really saving the child from any systemic disease. Then not to leave it, but we are also having mental issues or psychological issues with the child. There's sleep disturbances, the itch is constantly hampering his sleep. And these are all developmental years of the child when he need to have a good sleep. His all the physical and mental growth that is there in such a crucial period of his life is being hampered. And then definitely we
Mm-hmm.
have certain conditions, like sometimes patient may have some eye problems also. We say there is atopic keratoconjunctivitis, the multiple diseases which can happen. Then, as I said, if they're using different other creams other than what is required, then that also can create a lot of problems in the child.
Right, right. Now let's know about the treatment options which are currently available. When a child comes to us in the initial stage, what are the treatment that we offer, and what are the advancements that we get in today's time when it comes to the treatment?
So, as I said, atopic dermatitis, because of its global prevalence and now being realized very well that we can, if controlled well, we can really help the child. As I said, first of all the precautions that are told, the scented bars, the moisturization, and then these are the primary treatment. Among the primary treatment, we have certain topical steroidal cream preparations as well that we modify according to a child's age and the area where it has to be applied. According to its potency of the cream, all of this vary and it is very personalized according to the patient. Then we have certain non-steroidal preparations also available, like calcineurin inhibitors, JAK inhibitors. These are the new category of drug which is coming up, which have shown great result in atopic dermatitis and nowadays widely available in India also, and has shown great result in
Mm-hmm.
Indian population as well. So JAK inhibitors, both in topical and as well as oral forms, can be given to the patient. Then, with the advancement, we have certain biological agents also, biological agents that can be given to the child in the form of oral therapies, which can really help in cases which are resistant or recalcitrant, बार बार होने वाले या बिल्कुल भी दवाइयों से ठीक ना होने वाले डिजीजेस को हम इन सब एडवांस मेथड से बेटर कर सकते हैं.
Mm-hmm. Right, right. Doctor, when it comes to treating a child or when it comes to any sort of medication, हम एक चीज देखते हैं कि जब सपोज घर में दो बच्चे हैं और एक बच्चे ऑलरेडी सफर कर चुके हैं इस कंडीशन से एंड द नेक्स्ट चाइल्ड इज आल्सो समहाउ सीन टू बी सफरिंग फ्रॉम द सेम कंडीशन वी हैव द टेंडेंसी ऑफ सेल्फ मेडिकेशन मेडिकेटिंग द चाइल्ड कि हमारे दूसरे बच्चे को तो हुआ है डॉक्टर ने कहा है कि यही सब दवाई लगाने को या यही दवाई कंज्यूम करने के लिए सो मे बी द नेक्स्ट चाइल्ड विल आल्सो नीड द सेम तो ये जो प्रोसेस है सेल्फ मेडिकेशन का इज इट सेफ समहाउ और शुड बी कंप्लीटली अवॉइडेड
सी एज आई सेड कि बहुत सारी टॉपिकल मेडिकेशंस अवेलेबल हैं एंड इसे हम पर्सनलाइज करते हैं अकॉर्डिंग टू द पेशेंट कि वो एरिया क्या है, वो कितना एक्सटेंडेड है, सिवेरिटी क्या है डिजीज की. सो अगर आप सेल्फ मेडिकेट कर रहे हो, आप उसे नहीं जज कर सकते कि वो कैसा है. एंड इट इज वन ऑफ द प्रॉब्लम दैट वी फेस. द पेशेंट हैज ऑलरेडी अप्लाइड मेडिकेशंस एंड व्हेन दे आर कमिंग टू अस with infections, superimposed infections, it is we are unable to say what it is happening actually, because the medication has slightly helped him but also created a damage. So I think
राइट
if educated well, patients should try not to self medicate. As I said, you can do simple moisturization till the time you are able to visit your dermatologist so that the things are not worsening enough. But try to visit
राइट
as soon as possible. And as you have seen, the parent must have seen that if the elder or the younger child has taken the medication, they must have improved. So if the
राइट
other child would also take specific medication, specific category, because the duration of the medication also varies according to the child. So
राइट
no
राइट
self
एंड
medication.
डॉक्टर स्किन कंडीशन में हम अक्सर देखते हैं कि देयर इज अ टेंडेंसी ऑफ रेकरेंस तो ऐसे कंडीशन में रेकरेंस के चांसेस कितने रहते हैं
मैंने atopic dermatitis, as I said, it is a chronic recurrent disease. ये बार बार हो सकता है. So whenever the parent come to us or a child come to us, we try to educate them about the disease. वो कैसे इसे कम से कम कर
हम्म
सकते हैं, जो भी precautions हम समझाते हैं, अगर वो उन्हें proper तरीके से follow करते हैं, we see that the recurrences के chances बहुत ज़्यादा कम हो जाते हैं. And even if you see the earliest sign of recurrence, आपको लगता है कि अभी शुरू हो गया है disease, then definitely go to your doctor. You will start your medication. It can be sometimes tiring to you, but definitely uh, इसको छोड़ देना is not the solution.
Right.
You have to
Right.
take care of it. And as I said, many children get better in adolescence. बहुत सारे बच्चे
Right.
as the age increases they become better, and we gently guide them through this, that it is a chronic disease, but you have to take care of your skin. If you keep your barriers strong, then definitely you can fight off the disease.
राइट, राइट। सो हम कह रहे हैं कि दिस इज़ अ मेंटेनेंस थेरेपी जो हमें कंटिन्यू करना है फॉर द
Yes,
रेस्ट ऑफ आवर लाइफ।
definitely.
बट डॉक्टर, आई थिंक सभी जानना चाहेंगे, जितने भी व्यूअर्स हमें इस वक़्त देख रहे हैं, ऑल ऑफ अस वुड वांट टू नो दैट इज़ इट पॉसिबल कि ये कंडीशन कंप्लीटली क्योर हो जाए एट सम पॉइंट?
So as I said, it does happen. जो बच्चों को एटोपिक डर्मेटाइटिस रहता है, बहुत हद तक काफी बच्चों को ये बाय एडोलेसेंट पीरियड ठीक हो जाता है.
हुँ,
Naturally it becomes better. This is how the course is. Only 20-25% of the children who are having atopic dermatitis in their early childhood, they carry it in their adolescence also. But
हुँ, हुँ,
definitely जो थोड़ा भी carry करते हैं, there are multiple risk factors which are there: having a severe disease, early onset, family history, multiple other triggers, or a defective genetic barrier. These are the few reasons that they may carry it for a longer period. But as I said, if they are maintaining their skin well, taking care of it with proper moisturization and all the precautions that we talked about, all of these, they can really keep it under control. We do not require oral therapies or a steroidal preparation lifelong. We do not. Only in the
राइट,
phases of flare, patient can be put on that. That is just a phase of like 20-25 days or a month or 2 month maximum, but
राइट,
that can be controlled. And it should not be feared of, I think. uh, but definitely no dermatologist or no doctor can say that we will remove it to the core or remove it to the root. No, we cannot.
राइट,
Nobody can. It is your internal disease. It's an internal condition. We are just trying to put a break to it, or put a stop to it. And generally we
राइट,
see that it works out for most of the patients, but sometimes it may not also. But generally, if taken care of, or if we handle the patient well, we see that they do very well in life.
right. Uh, and normally, when we talk about our skin, I think it is something which should be a routine. Taking care of our skin should be a routine that we follow on a regular basis. ऐसा नहीं हो सकता है कि आज एक दिन आपने लगाया और फिर एक हफ्ता आपने कुछ भी नहीं किया. It should be a regular routine. We should always try to make mm, taking care of our skin a part of our daily regime. आई थिंक फिर लंबे अरसे बाद आप देखेंगे कि आपका स्किन समय के साथ इट विल डेफिनेटली चेंज, इट विल
Definitely.
डेफिनेटली गेट बेटर, ऑफ कोर्स अंडर एन एक्सपर्ट्स गाइडेंस। ये हमेशा हम कहते हैं हमारे व्यूअर्स को कि आप कोई भी अगर अपने शरीर में बदलाव ला रहे हैं, अपने स्किन में, अपने हेयर में बदलाव ला रहे हैं, मेक श्योर कि आप किसी के गाइडेंस में, एक्सपर्ट के गाइडेंस में ही ये सारी चीज़ें कर रहे हैं। वेल, मूविंग अहेड टुवर्ड्स द नेक्स्ट क्वेश्चन डॉक्टर। अगला सवाल हमारा है आपके लिए, व्हिच इज़ अगर हम डेली स्किन केयर के बारे में बात कर रहे हैं, सो व्हाट काइंड ऑफ डेली स्किन केयर रूटीन शुड बी फॉलोड फॉर एन एटोपिक चाइल्ड?
So, as I said before, also that first of all, use only scented bars or a very mild soap or pH balanced soap for cleaning your body. Use only lukewarm water, not very cold, not very hot. Just a lukewarm water to take a bath. And after you have taken a bath, the skin is wet. Apply a good amount of moisturizer over the body. Always try to wear cotton sort of a clothes which are very breathable and absorbing. These are a better suited rather than a synthetic clothes for yourself, because there are higher chances of rashes otherwise. Then always try to use products in the form of deodorants, or even in the form of scents that you use. These are hypoallergic, not very fragrance. Then not so many scents should be there, or very loud, because sometimes it can lead to allergies in you. So choose your products wisely so that they are not very allergic. Use try to read their content, and if it is anyway causing you any dryness or a rash, try to avoid it in future. These are the few things that we say. And even in whatever they're wearing, from their socks to their shoes, everything, they have slight more tendency to develop allergy, so you need to see what is suiting them well and what is not.
Right.
If it is not, then they should definitely leave the practice and change to something which is more hypoallergic and more suitable to them in a daily routine.
Right.
And moisturization
Right.
as frequently as possible, at least twice in a day, once in morning and
Mm-hmm.
once before sleeping. This is the minimum they should do.
Right. Right. Also regular hygiene, as you said, doctor, is very, very
Definitely
important.
regular. As I said, patient do avoid bathing, but it should not be. Patient should take a regular bathing. Regular
Mm,
bath should be taken, and other precautions. I said that they have to keep themselves away from a very dusty or a polluted environment. Try to avoid pets as much as possible because sometimes can cause allergies. Sofas, patients have sofas which has a lot of dust on it, so make sure that you're cleaning your sofas and all this well, vacuum cleaning all these areas because a constant
mm,
dust or a mild dust can also cause allergies in such patients. So these are a few things that one should make sure that they're doing for their children and they can really be helped in this condition.
right. Right. We have a similar question coming up from a viewer. Next, we are going to go through the viewers' questions now. Well,
Definitely.
Rita Tirki asks, can pets trigger or worsen atopy?
So we see that a lot of see pets, though I know we all love our pets, we try to keep them
Right.
clean as much as possible, but somehow their furs, the small dust which are there
Mm,
in their furs, these can trigger allergies in atopic child. Not as such, but they can trigger it or worsen it. It is not causing it, but definitely it can trigger. We do not say
right.
that completely avoid it, but definitely keep it to the minimum so that they are not triggering the rash in you.
Right. In the next question, the viewer asks, can food allergies cause atopic symptoms?
So, as I said, that they are interlinked. We see that patients who are having food allergies can have allergic symptoms on their skin as well. So, these can be one of the triggers for atopic dermatitis as well because your body is having a predisposition to allergies, majorly, in the
Right.
simple language.
Uh, Right. Well, doctor, you have been continuously speaking about the usage of lukewarm water when it comes to this particular condition. So the similar question comes from another viewer who asks, does lukewarm water help reduce itching?
So, it is safer actually. If you're
Hmm.
using very cold water, that can be very harsh to your skin, and even though very hot water can be very harsh to your skin, it's breaking a barrier. Lukewarm water is said to be more suitable for such atopic
Right.
children because it is soothing, it is not causing any damage to your barrier further.
Hmm.
So that is why we prescribe lukewarm water.
Right. But doctor, what about the people who are living in the uh, like the hotter areas, like the warmer regions? It is difficult for them to use the lukewarm water.
So
Also, nowadays, yes, yes. Uh,
So I will
so
say
we
that
have.
if you're working in some temperate countries or a tropical countries, I see a lot of patients are just using very chilled water to take a bath. But do not do that.
Right.
You can use something which is not very cold. Just be a normal
Mm-hmm.
temperature would really work. If you want to take a
Right.
bath, take it from a normal temperature rather than taking very cold baths because they can further dry up your skin actually.
Right. Now speaking of water usage, doctor, we have seen the water nowadays in most of the region, it has worsened with time. There is a high iron content in the water available everywhere, mostly everywhere, especially in the metro cities. So we get the water filters nowadays, which the doctor also suggests, using the water filters for the taps and the showers. Do we also suggest the same for the children who are suffering from the same condition?
See, definitely, if you feel that the water that you're getting in your households are contaminated or very harsh or it is not suitable for bathing, then definitely you can go for certain filters. Now we have this opportunity or
Mm-hmm.
availability of such filters, and definitely we should use because we are trying to protect the child from major allergens. So if we can do so, it would be a
Right.
better choice, definitely.
Right. Now, as we are speaking about water, doctor, we nowadays we try to teach our children how to swim in a very young age. So, is it that using the water in the pools can somehow, worsen the condition, or can it also act as a trigger?
See, we do see such kids who are going to swimming and they are getting
Mm-hmm.
rashes and exacerbation of atopic dermatitis. So in such cases, I generally recommend that they are using their pre-swim creams are there nowadays available, which keep
Right.
your body slightly more resistant to the harsh chlorine which is there in the water. If you're such a enthusiast for swimming,
Mm-hmm.
then definitely after going for a swimming, then take a quick shower and apply your moisturizer well. Do not let it sit on your skin for a longer time. These are a few precautions that you can take and let not the rash just develop. And if it is not suiting your skin, then definitely I say to avoid swimming. You can take up any other sport if you want. But
Right.
moisturization definitely helps most of our patients. If they are going for swimming, if they are moisturizing it before going to the swimming and after they're coming out of the swimming, then it really works out.
Right. The next question, doctor, comes from Deepak Desai, who asks, can aloe vera and coconut oil soothe itchy skin in children?
So, so aloe vera directly we do not prescribe. Why? Because there are multiple irritating agents which are there in the plant extracts which can definitely irritate the skin. Now coming to the
Mm-hmm.
coconut oil, definitely coconut oil is a very good moisturizer and we do prescribe it to our kids who are having atopic dermatitis. It can be used. Coconut oil can be easily used, but sometimes the moisturization is not enough with it. That is why we ask for something, a better form of moisturizations, which are given the different moisturizers that we prescribe.
Right. And the last question, doctor, comes from Hemant Singh, who asks, can harsh soaps worsen atopic skin? I think we have already spoken about it, but
Yeah.
would you like to add anything to it?
So definitely harsh soap can worsen it. The high alkaline, the nature of the soap can really damage your barrier. And this is one easily changeable or it can be easily changed in your life, right? So if we just change the soap and we can do something better for the skin, I think we should definitely do. So avoid the harsh soaps and take something like a no soap bars and Syndet bars or something in a liquid cleanser which are mild and soft to the skin.
Right. Well, with that, doctor, we had a wonderful session with you today. We got to learn a lot from you today from the session. Before we take a leave, any take-home message for our viewers who has watched us so far?
So, for the viewers, I will say that atopic dermatitis, I know we are always considering it as a chronic disease, but definitely it can be treated and the child can be cured of the itch if you are coming to the dermatologist at a proper time. Control the itching early, regular care of the skin is something which equalizes to a healthy skin. So
Right.
don't delay and hurry. Take the treatment and be regular to it, and it will definitely pay off.
Well, that was the expert advice for today, and that was Dr. Bharti Aggarwal for us. Thank you so much, Doctor, once again for
Thank
sharing your valuable insights with us. It was truly an informative session and very enlightening for our viewers today. We are sure that this discussion will help many patients better understand and manage atopic condition in their children. And we would like to thank each and everyone for joining us today. Stay connected with Radiance with you for more such informative session. And do not forget to like, share, and subscribe to our channel. Thank you. You all stay safe and stay healthy.
Thank you.